So today we're going to talk about Urticaria. Urticaria. So it's also known as hives, yeah? In Uganda we call it ebilogologo. I know many of us are like victims to getting ebilogologo. So let me first tell you a brief story. So one time I got Urticaria. So I was at my auntie's place and like these people thought like I was bewitched, yeah? So they smeared me with banana, like this yellow banana. So they got yellow banana, they smeared me the whole body. So I spent the whole day in yellow bananas, like I was smeared. The whole body like was smeared with yellow bananas. So like it didn't go away. So I was there for a long period of time until my mom took me to the hospital. That's where I healed from, yeah. So urticaria is a skin condition that causes itchy red welts to appear on the skin, yeah. So these welts can vary in size and shape and can appear anywhere on the body, yeah? So urticaria is triggered by very many factors. So very many things can cause urticaria. So the first one is allergies. So certain foods, medication, insect stings, and other allergens can trigger allergic reaction, yeah, and leads to urticaria. So infections, we can also talk about infections. So infections can also trigger urticaria. So if you have viral infection, bacterial infection, so sometimes that also causes urticaria. So you can also talk about physical triggers, yeah, like we can talk about cold, heat, sunlight, pressure or vibration, yeah. So those ones can also trigger urticaria. So you can also talk about autoimmune diseases, like in some cases hives, yeah. This urticaria may be a symptom of an underlying immune disorder, yeah? So we can also talk about medication. So medication such as aspirin, antibiotics, and blood pressure medication can also cause urticaria, like as a side effect, yeah. So what are the symptoms? What are the signs that you can know that I may be having urticaria or my son might be having urticaria? So the first one is the main symptom of urticaria is itchy raised welts on the skin. Like these welts can vary in size, yeah, and shape. So the second one is itching. Like if you have the itching which is very intense and in most cases it can interfere with your sleep, yeah? So the third one is burning or stinging sensation, yeah. So that's also a sign of urticaria. So the third one we can talk about angioedema, yeah. Angioedema. So this angioedema is the swelling of the deeper layer of the skin, yeah. So if you have that swelling, that means you might be having some urticaria. So what's the home management of simple urticaria? So what if your child gets urticaria at home, yeah? Like before taking that child to the hospital, what can you do there to prevent further complication? First of all, identify and avoid those triggers. Like you identify what triggers the allergy. Like if it's milk, if those dairy products, yeah, like you identify them. So if it's medication, like you first consult your doctor, ask your doctor that what are the medications that can lead to this child's allergies, yeah. So such that you can avoid the like giving them to the child such that you complicate the condition, yeah. So also you can do some cold compresses. So apply a cold compress to the affected area of the skin, yeah. So we can also talk about cold baths, like take a cold bath if you get some urticaria. Also moisturize your skin, yeah, like to prevent a dry skin, yeah. So also wear loose clothing, like if you get urticaria. Also avoid scratching when you have urticaria. Also you do some stress management. It can be stressful for you, like most cases the girls, yeah, like they think about their skins, so sometimes they get stressed when their skins have problems. So you do stress management. You know, we talked about stress management. You can do some deep breathing exercises to avoid urticaria, so to avoid that stress that comes from urticaria. So when do you go to see a doctor immediately when you get urticaria? So the first situation is if you have difficulty in breathing, you should rush immediately to the doctor and get some medication. You should go to the hospital. So if you also have some swellings on the face, lips, tongue and throat, yeah, so you should rush to the hospital immediately such that you get some proper management. So the third one is hoarsening or difficulty in speaking. So if you have some difficulty in speaking, or if you have some hoarsening, you should immediately run to the hospital and get some treatment. So the fourth one is dizziness or fainting. So if you have some dizziness or fainting, you should immediately rush to the hospital for some management. So we can also talk about rapid weak pulse. So if you have a rapid weak pulse, you should immediately go to hospital and get some good management. So you can also talk about if you have chest pain or tightness, yeah, you should immediately go to the hospital and get some treatment. So we are going to also talk about how do we prevent urticaria. How do we prevent urticaria? So in the first step of preventing, so identify and avoid the triggers. Like if you have food allergies, like you should identify the foods which you have allergies on. Like if you have allergies on dairy products, identify it immediately. So the second way is informing your doctor about your history of hives, yeah? Like urticaria, yeah? And discuss the potential medication. So you can talk to your doctor, and like your doctor can give you treatment. Like if you get urticaria, what medicine do you use, yeah? So your doctor can tell you the medication which you can use. So you can also talk about like identifying the allergies which you have. Like if you have allergies on pets, like this pet dander, so identify it very well so that you can avoid it. You can avoid the pets. If you have pets, you can like bathe them very well such that they reduce the dander on them. So you can also talk about physical triggers. Like if there are physical triggers like extreme temperatures or sunlight, you should know that in these extreme temperatures I get urticaria. So you should know and start avoiding it. Identify it and avoid it. So also we can talk about maintaining a healthy lifestyle. So in maintaining a healthy lifestyle, you can talk about stress management. So you manage your stress very well, and also you can talk about good hygiene. So if you have urticaria, if you're like a person who gets urticaria, maintain a good hygiene. Like you bathe very well such that you prevent those skin conditions, yeah. So thank you very much. I'm Mujib, and if you have any question you can ask me, yeah.